This video focuses on the distinction between assessment and diagnosis in social work practice. It aims to deepen your understanding of how these two concepts differ, intersect, and contribute to ethical, effective practice. Assessment is a foundational process in social work that involves the ongoing, collaborative gathering of information about a client's needs, strengths, and environment. It emphasizes the person and environment perspective and is always evolving. Diagnosis is more of a static process, typically grounded in clinical frameworks like the DSM. It involves assigning a label based on observed symptoms and patterns, often necessary for insurance billing or accessing certain services. So, why does this distinction matter? In social work, we are committed to honoring the client's voice and experience. Assessment allows for a dynamic, strengths-based understanding that can empower clients. Diagnosis can reduce individuals to a set of symptoms, potentially reinforcing stigma or ignoring social context. As practitioners, we must be cautious in how we use both assessment and diagnosis, ensuring we act ethically and align with the profession's core values. Assessment starts with the worker. We must understand our own values, biases, and limitations to ethically support our clients. Next, knowing your agency's capacity helps align client needs with resources. Assessing your agency's fit with the client's situation is essential. Assessing the client system is where much of our work happens. We examine the client's history, relationships, family structure, and cultural identity. We must always remember that we are not only looking for problems, but also identifying strengths, resources, and resilience. How has the client survived? How have they coped in the past? Lastly, clients don't exist in a vacuum. Their social, political, and economic environments shape their experience. Social workers assess the environmental system to understand why someone is struggling and how to intervene meaningfully. An intake form might seem routine, but it is a powerful tool when used intentionally. It allows for systematic data collection, ensuring nothing critical is missed. When used collaboratively, asking questions with curiosity and empathy helps build rapport. It also sets the stage for identifying goals, unmet needs, and the client's inherent strengths. While every intake form is different, there are some general characteristics: demographic information, emergency contact information, employment information, reason for seeking counseling, medical and mental health history, substance use, family and social history, psychological history, goals for therapy, and consent and confidentiality. You are encouraged to compare different forms and critically think about what information you would want to obtain from a client if you were doing an assessment.